Hi, my name is Ben Carlson in my audience.
Hey, I'm Lynn Albright.
I'm Morgan Carney.
Eric Albright.
Tess Flanders.
Paul Flanders.
By a show of hands, who has dealt with pain in their knee? Yeah, me as well. I have a knee injury that is now chronic that happened to me while I was playing baseball in college a long time ago. But it has stuck with me because I did not at that time pursue physical therapy or a doctor. So I'm passionate about the subject of why physical therapy is good for an injury and why it can help you progress through pain and possibly heal. So according to MoveForwardPT.com, approximately 25% of all American adults deal with knee pain that affects them throughout their day. So it's easy to deal with pain for some people specifically, but it's easy to just kind of push through pain and pretend like it's not there. But the problem with that is that if you push through pain and don't go and find somebody that has professional opinions for improving that, it will develop into a chronic problem. So what would you, Paul, say that pain is your body saying? What does pain say?
Ow.
Yeah, Lena?
It says something's not right.
Something's not right. Stop. Don't do that again. So what what your body is saying is that I'm injured and I need you to stop your activity so that I can recover. Now, some injuries are you're able to work through them, and some injuries are muscular and can be rebuilt and redone. Some injuries require surgery. And so it's very important that you find a professional that has a good level of training to tell you how to deal with that injury and how to move forward. So understanding PET and what that does for your body is important because it will help you better understand how to read an issue with your body and know that you're out of your element and you need to seek advice. Also, help other people look for correct places to go with help. So according to a local OTA, Savannah Carlson, that I was able to interview, the following is the order of evaluation and how it occurs. So A is the diagnosis. So if you're injured and you need help, you would first go to a hospital and look for a doctor, or in some circumstances a physical therapist, who are also doctors. And they would diagnose the problem, tell you what's going on, and then they would send you to the physical therapy department. At point B is the evaluation. The physical therapist would then, from that point, take you into his office and tell you exactly what the process is that you're going to have to go through in order to get help and work through the problem. So C is where the PT or the PTA will carry out the plan of care, and the plan of care is those steps in which the PT is set. And also probably prescribe you home exercise to take home so that you can maintain the progress that you're achieving in the office. And then D would be discharge. So once you have gone from the point of the PT telling you what your status is with your injury to progressing through that and finding your full level of function again, achieving that, then they would discharge you from PT care. So that brings me to the main bulk of what I'll be talking to you about. So I'm going to be talking to you specifically about an anterior cruciate ligament tear, which is also the same as an ACL tear. According to verywellhealth.com, loss of motion is going to be your main issue with the majority of your ACL tear. post-surgical, there has been studies that have shown that post-surgical, you have to pursue PT or some form of help in order to progress through those things. If not, you will wind up with what's called contractures. And contractures are where your joint actually locks up. And so as you work through those things to avoid contractures, if you don't do that, if you don't avoid contractures, you're going to wind up with structural concerns. With an ACL, it is ligaments that cross-sect the knee, and they provide a lot of stability, and they also provide structure where your shin bone stays in line and doesn't roll out from your thigh bone. So if those are compromised, it's going to create a snowball effect, which can cause back pain and bilateral pain and a lot of different other issues structurally throughout the rest of your body, especially vertically. So what does the ACL do? That is what I just walked through. According to Savannah Carlson, that I was referring to earlier, what the PT can offer a knee injury, specifically the ACL, for this talk, is a PT will use the time that they have with you in their office to assess what your range of motion is with your injury, assess what your range of motion was prior to the injury, and they will work to create function throughout the range that is damaged to increase you to full range of motion, or ROM. They will work with you to strengthen those things along with flexing. They will strengthen so that you can go back to your original function. And they will also, in their office, be able to, throughout that process, catch damage if it's happening. So if you were to take something home with you and like a surgery, if you were to go home and just progress through exercise programs that you find on your own, you risk actually making the injury worse because you are not finding a professional opinion, and damaging those things can actually make surgeries reoccur or other things like that. So through their plan of care, they can bring you back to prior level of function, and then they will also give you home exercise plans to take with you so that you can avoid injuries later on. So the PT will also, like we said before, they'll assess what your current to prior level of function was, and they won't let you go, and they'll maintain the insurance and all those things that you need in order to progress through the full thing. So to summarize, it's important to me because I am currently going through PTA schooling it's important to me to have people understand that what PTs do and what doctors do and all of the professionals in those fields do is very important, that you seek their professional help and be proactive so that you don't wind up with chronic injuries. Rely on their help because they've gone through schooling for these things, and they know all of the different ligaments and all of the different things inside the knee, which according to verywellhealth.com, there are actually 10 major knee injuries, but there are a list of possibles. So it's impossible to know that by yourself. So PT can get you back up to where you need to be in order to function with work and go back to your normal life. Thank you.